Hi everyone, my name is Kylie James. I'm a certified nutritionist here at Koru Nutrition. Super excited today because I have Dr. Karm Hans, our new naturopath doctor at Koru Nutrition. So welcome, Dr. Karm.
Thank you.
Um, so today I wanted to sort of talk about adrenal fatigue because stress is a huge issue right now with the pandemic and with everything that we've been going through for the last couple of years. I'm sure everyone has or is really stressed out. And with stress can sometimes come adrenal fatigue. So I wanted this opportunity to sort of pick your brain, sort of what the testing you do for that, what is adrenal fatigue, and what sort of treatment recommendations you would do for someone with adrenal fatigue. But I guess if we could just start off by why did you decide to become a naturopath doctor?
Yeah, absolutely. I would say one of the biggest reasons was actually my mom. When she migrated to Canada, she developed migraines. And so throughout my whole childhood and my adult life, I'd seen her suffer. And she was always that type of person that would try anything just to try to make it better. And one of my coworkers actually started seeing a herbalist for her migraines and found a lot of benefit. And so my mom signed up. She used to take me to the appointments with her just because she didn't feel as comfortable because English isn't her first language. And I just saw this whole other side where you're talking about diet, nutrition, detox, sleep, all of these things that were never discussed before. And about a period of, I would say, maybe a month, maybe 2 months, her frequency and the intensity of her migraines drastically reduced. So I was like, I need to know more. And that's what really prompted me to investigate what else is out there. And that's what led me to naturopathic medicine.
Oh,
Mm.
awesome. Yeah, I feel like a lot of people getting into the sort of industry, like nutritionists and naturopath doctors, a lot of people have that
Yeah.
personal story for sure. Um, so let's talk about adrenal fatigue. It's something that gets grossly overlooked in terms of diagnosis. Can you tell us a bit about what adrenal fatigue actually is?
Yeah, absolutely. How I always like to explain it to my patients is kind of starting out like what part of the body is affected. So the adrenal glands are ones that are not discussed often. And the main reason I think for that is that there are pathologies associated with them, but they're quite on the rare side. So naturopathically, holistically, we talk about it very often. And so there's small little glands that sit on top of your kidneys, and they really influence how we deal with stress. So they produce a variety of different hormones. And basically, when it comes to adrenal fatigue, there's so many different symptoms that kind of go along with it. And we were talking about this earlier, but so much of it goes undiagnosed because there's such general symptoms. For example, fatigue in terms of like weight gain, anxiety, depression. There's so many like issues with sleep, falling asleep or staying asleep, being startled very easily, low blood pressure. There's so many different symptoms that can kind of go along with it. But it's not something that is conventionally accepted as a diagnosis. So we really talk about it. It really comes out when we're discussing it with our patients or our clients in terms of how are they feeling and what's their baseline like.
Awesome. So, if someone came to you and stress was an issue and you were suspecting adrenal fatigue, what sort of tests would you do? Because that's the one thing I really love about you guys is all the diagnostics that you do really help defining like the underlying reason or underlying cause of the issue.
Yeah, absolutely. So there are certain blood tests that we can do. The main one would be cortisol. So that's one of our biggest stress hormones. And what happens in adrenal fatigue is that we're just not making enough. The way I describe it is it's almost like the adrenals have become tired. They're sluggish because stress is not something that we sort of are in at certain periods of time and then we are not in stress. We're just sort of consistently in stress. And the pandemic hasn't helped because now it's just added another layer on top of it. But we would focus on cortisol. You can do blood tests for it. It generally should be done first thing in the morning, within a few hours of waking up. And then there's other hormones. There's one that's called DHEA. But I would say the best way to test it is to do a salivary test. This is something because we know that cortisol levels change throughout the day. They're the highest in the morning and then the lowest later on in the day in the evening time. And it sort of has this curve or this sort of rhythm to it that we like to see. So you actually do a salivary test at 4 different times in the day, and that gives us the best results when it comes to assessing adrenal fatigue.
Okay, cool. That's really interesting. And then so someone comes in, they do the salivary test, and then it comes up that the cortisol is out of balance. So what would be the next step or the things that you would recommend to help balance the cortisol and support the adrenals?
Absolutely. And I do find for a lot of patients, it can be very much part of sort of the root cause that we're always after of what was sort of like why they have all of these symptoms in the first place. So if the adrenals are tend to be like the biggest area that we need to discuss, there's certain nutrients that are involved, even something simple as vitamin C. But there's a lot of different herbs that I tend to use a lot more. So if you wanted me to go into a little bit more detail, I like to use herbs like ashwagandha, in terms of things like rhodiola or holy basil. There's just so many different ones. We call them, they're actually like a group of herbs called adaptogens, basically help us to adapt to stress. So we would kind of figure out what would suit that particular person. There's also like licorice is another really great herb, and trying to find out based on other symptoms that are happening with that individual, like what is the best approach? Is it more something that's in a liquid form? Is it something that's more herbal based, like in a capsule form? So we kind of figure that out from there.
Yeah, it's interesting because like as nutritionists, we do a lot with blood sugar balance. And I always talk about when blood sugars drop, your body naturally produces that stress hormone cortisol to raise your blood sugars up. So if you're someone that's stressed, skipping meals or having like refined carbs and like high sugar foods, then you're going to get that blood sugar yo-yo. When it comes down, your body's naturally producing that stress hormone cortisol as well. And it's interesting. I did some research about like I mean, we do need cortisol in healthy amounts, but I mean, my understanding is that if we have too much cortisol, it's responsible for that nice tire around our waist, which a lot of buffs have. But what are some of the other negative impact that having too much or not enough cortisol in our body can do?
It's actually, if we start to look at it a bit more holistically, instead of just focusing on the adrenals themselves, that was a really great point that you mentioned in terms of blood sugar balance and that the liver and all of these like insulin, all of these things that are involved. So we start to expand our idea around not just the adrenals, but what are the other systems that it's strongly connected to? Because our body system, all of them are working together. They're all connected. But the three that are very tightly connected with, or the adrenals are one, the thyroid, and the reproductive hormones. So with women, it could be menstrual issues, like really strong PMS type of issues, issues with fertility. It could be thyroid, and then again, in terms of easy weight gain, difficulty losing weight, temperature dysregulation, feeling really cold all the time, hair loss, hair thinning. So there's like really the symptoms that can be associated with the adrenals from a root cause perspective is really the whole body. Like almost any sort of aspect of your body that you can think of could be attributed to, it could be connected with adrenal fatigue.
Interesting, eh? So, so you talked about supplements. Is there any lifestyle recommendations that you would recommend for someone that has adrenal fatigue?
Oh, absolutely. And actually, I would say that I'm glad that you brought it up because I would actually say the lifestyle aspects are even more important than the supplements because we really want to make sure that our foundational parts of our being are balanced. So if we think about sleep, I think a lot of us are, we're taking our phones to bed. Maybe we're watching TV right before we go to sleep. Maybe we don't have quite the same routine. I've had some of my patients say that with working from home. If they are working from home, they may be like waking up at different times, and if they don't find that there's a certain schedule that their employer is keeping them on, maybe they're not sticking to a certain schedule. So routine is really key. We want to make sure that we're waking up at the same time and going to bed at the same time. Our adrenals love routine. Even eating around the same time is really beneficial as well. And also things like meditation or something relaxing, whether it's like, it's hard when it's cold outside, but to get out into nature, get some fresh air, get some activity, do some meditation, like put on like a YouTube video for like a guided meditation or some deep breathing exercises, even if it's only for a minute. If it's for like a minute to 10 minutes, it will still have a profound effect on how our stress hormones are able to balance themselves.
Yeah, it's such a good point. Like during the pandemic, I bought the Peloton, and I've been loving the Peloton app. And I do regular yoga, but I've been loving the restorative yoga, which is pretty much just staying in a relaxing position for like 5 minutes. And I noticed such a difference with my sympathetic nervous system, like calming down and just feeling so relaxed. And I've done it with my 6-year-old a couple of times, and he's actually fallen asleep doing it with me. Although it's not so relaxing because then I have to carry him up 2 flights of stairs to put him to bed. It's like, okay, now the stress is coming back. But that's awesome. Like I do find it really fascinating, the adrenals, and I think we sort of forget about them a lot. And again, like especially in this time that we're living in with the pandemic and lockdowns and trying to do online schooling and maybe for financial concerns, it's such a big thing for us to be aware of. So I appreciate you coming on and sort of telling us a little bit more about adrenal fatigue and what you can do. So thanks, Dr. Karm Hans, and we'll see you guys soon.